Dentico YouTube channel. Here I will post all types of dental study videos which will help you in all types of dental examination. So if you are new on this channel, then please subscribe this channel and hit the bell icon so you will not miss any new notification from this channel. Okay, so today's our topic is Diabetes Mellitus. Okay, Diabetes Mellitus. At first we will see the introductory part of the Diabetes Mellitus. At first, the definition of Diabetes Mellitus. What is Diabetes Mellitus? Diabetes mellitus refers to a group of common metabolic disorders that share the phenotype of hyperglycemia. मतलब डायबिटीज कुछ हाइपरग्लाइसेमिया के रिलेटेड है, ठीक है. डिपेंडिंग ऑन द etiology of diabetes mellitus, factors contributing to hyperglycemia include, मतलब हाइपरग्लाइसेमिया किस किस वजह से हो सकता है. दैट फैक्टर्स आर रिड्यूस्ड इंसुलिन सिक्रीशन, इंसुलिन ही सिक्रेट नहीं हो रहा है, अगर हो रहा है तो बहुत कम हो रहा है, ठीक है. देन डिक्रीज ग्लूकोज यूटिलाइजेशन एंड इंक्रीज ग्लूकोज production. Okay, due to these three factors the hyperglycemia occur. Now we will see the types of diabetes mellitus. Diabetes mellitus is classified on the basis of pathogenic process that leads to hyperglycemia. It means we have to see the first pathology or the pathogenesis of the diabetes mellitus. Okay, and due to that the hyperglycemia situation occur. So first is the type 1 diabetes mellitus, type 2 diabetes mellitus, and except from this there are some other types of diabetes mellitus also. So type 1 diabetes mellitus is a result of complete or near total insulin deficiency. मतलब कि type 1 diabetes mellitus इंसुलिन की deficiency की वजह से हो रहा है. Then second is the type 2 diabetes mellitus. It is a heterogeneous group of disorders characterized by variable degrees of insulin resistance. There are mainly 3 points. Okay, you have to remember these 3 points: variable degree of insulin resistance, impaired insulin secretion, and increased glucose production. Okay, these 3 factors. Now other types of diabetes mellitus are the maturity onset diabetes of young, which is also called as MODY, not Modi, it is MODY. Okay, so MODY is an inherited form of the diabetes mellitus. Okay, it is inherited and it is caused by a change in one of 11 genes. Okay, up to the 5% of cases of diabetes mellitus is related to this. Then another one type is the GDM, which is also known as the gestational diabetes mellitus. At the time of pregnancy, it is seen in pregnant women. Okay, and due to GDM there are increased chances of diabetes 2. Okay, मतलब diabetes mellitus type 2. Now we will see the diagnosis of diabetes mellitus. Okay, so first is the criteria for the diagnosis of diabetes mellitus. What are the criteria for diagnosis of diabetes mellitus? Okay, at first we have to see the symptoms of the diabetes. If patient is symptomatic with diabetes, it is symptoms of diabetes plus random blood sugar is more than 200 mg per deciliter, or else we can also check by the FBS, which is fasting blood sugar, which is more than 126 milligram per deciliter, or the HbA1c. HbA1c. Now what is this HbA1c? It is a glycosylated hemoglobin, is a form of hemoglobin which binds with the glucose or glycose or fructose, whatever types of sugar. So if the glucose is present in our blood, then it will bind with the hemoglobin. So we can check that diabetes is in patient or not by HbA1c. This is a test also. This is a test only, sorry. Then another one is a 2-hour plasma glucose 11.1 millimole per liter. Okay, during an oral glucose tolerance test. अब ये oral glucose tolerance test क्या है? It is a medical test in which glucose is given and blood samples taken afterward to determine how quickly it is cleared from the blood. मतलब कि हमें पेशेंट को पहले ग्लूकोज देना है और 2 घंटे के बाद हमें चेक करना है कि उसके ब्लड में कितना ग्लूकोज अभी भी पड़ा हुआ है. ओके, सो दिस इज ओरल ग्लूकोज टॉलरेंस टेस्ट. Now we will move to the risk factors of the type 2 diabetes mellitus. So mainly there is the family history of diabetes. Okay, then second one is the obesity, physical inactivity, Some races like African American, Latino, Native American, Asian American, Pacific Islander, okay. Then previously identified with IFG, IGT or an A1C of 5.7 to 6.4 percentage, okay. So this is the fasting blood sugar, IFG, IGT, random blood sugar, and the last one is the A1C, which is also you know already, HbA1c. Then history of GDM or delivery of baby or more than 4 kilogram, okay. So as you all know that gestational diabetes mellitus is a risk factor for the type 2 diabetes mellitus, okay. Then the hypertension, HDL cholesterol level, polycystic ovary syndrome, and the history of cardiovascular disease, okay. Now we will see the clinical features of the diabetes mellitus. First is the polyphagia, polydipsia and polyuria. You have to remember these three at first. Polyphagia, polydipsia and polyuria. Polyphagia means increase in appetite, polydipsia means increase in thirst, and polyuria increase in urine, okay. So polyphagia, polydipsia and the polyuria, khana, pina, jana. Then the last is the weight loss, myalgia, weakness and fatigue, okay. Now we will see the complications. There are mainly two complications are divided into two. One is the acute and another one is the chronic. Okay, so first which complications are the acute? Diabetic ketoacidosis in type 1 diabetes mellitus. Okay, so what is diabetic ketoacidosis? It is a condition where if insulin is not sufficient in our body, due to that the acid formation, mainly ketone, occurs. So this this condition is known as the diabetes ketoacidosis. After that, the hyperglycemic hyperosmolar state. Okay, so it is a complication of type 2 diabetes mellitus. Okay, this is seen in type 1 and this is seen in type 2. Okay, so it involves extremely high blood sugar level without the presence of ketones. Okay, now we will see the chronic. Chronic is again subclassified into microvascular and the macrovascular. The microvascular, first is the eye disease, then neuropathy and the nephropathy. In eye disease, first is the retinopathy. It can be non-proliferative or proliferative. After that, the macular edema. Okay, the fluid are मतलब फ्लूइड वहाँ जमा हो जाता है, ठीक है, मैक्यूला में, विच इज़ अ पार्ट ऑफ रेटिना. आफ्टर दैट द न्यूरोपैथी, सेंसरी एंड मोटर, विच इज़ मोनो एंड पॉलीन्यूरोपैथी. इट अकर्स मतलब नर्व डैमेज हो जाती है मेनली इन लेग एंड फीट. ओके, सो it is a sign of diabetic foot also. Okay, then autonomic and the nephropathy. Now we will see the macrovascular. Okay, that those are the microvascular. Now we will see the macrovascular. In macrovascular, coronary heart disease, peripheral arterial disease and the cerebrovascular disease, and the other are the gastrointestinal, genitourinary, dermatologic, infectious, periodontal disease and hearing loss. So in this video we see the introductory part of the diabetes mellitus, clinical features, types and risk factors. In the upcoming video we will see the treatment part of this diabetes mellitus. Okay, so if you are really like this video, then please like it, share with your friends and don't forget to subscribe, hit the bell icon so you will not miss any new notification from this channel. Okay, thank you.